There is a new leader to oversee Parkland Hospital's big move next year. Dr. Frederick P. Cerise comes from the Louisiana State University Healthcare Network, and he is the new CEO of Parkland Hospital, and he is joining us now in studio this morning. Welcome to North Texas.
Thank you. Good morning.
You know, my assumption is that most hospitals, when they hire a new president, it doesn't come with this much fanfare and television interviews and everything. But I mean, you're taking over an iconic place at a really pivotal time. What are you facing as you come into this job?
Well, you know, as you said, Parkland it's a big deal. You look around the country, people recognize Parkland as one of those leading public hospital systems, and so there's a reason it generates a lot of excitement. There's a lot going on at Parkland, you know, and it's been through a turbulent time. And in the days that I've been able to spend there and talk to the staff and talk to the people that use the hospital, it's apparent people are ready to turn the page and get to stability and start looking forward. And so we'll be moving into a new facility. We've got a lot to keep track with the new healthcare reform and changes to the healthcare environment. So there'll be a lot of things to pay attention to.
And there are challenges. Obviously, there's a lot of challenges that come with running any institution that large, but Parkland has been the target of investigations in recent years over payment and safety from the federal government. How do you take or just kind of insert yourself into that and do it effectively?
Well, the good news is I'm coming in at a time when a lot of the corrective actions have been put in place and done. The federal government had a systems improvement agreement in place that the hospital implemented, like 499 action items to address the concerns that the regulators had. So a big part of our challenge is going to be not backsliding, making sure those systems and processes and measures that have been put in place, we continue to adhere to them. We continue the reporting that we need to continue to do. And since a lot of that heavy lifting has been done, now we can look forward and say, okay, now what do we want to be?
What is the most impressive part structurally of the new hospital?
It's a big place. When you look down that one hallway that goes for 600 feet, it is a big place. But you know, Parkland is full today, and so there's a lot of inpatient activity. I know there are concerns from people of it's a big inpatient hospital, and a lot of the action now is in the outpatient arena. And I've heard that a lot. Is, you know, we need to be out in the communities and in the clinics, and we need to do that too. So we need to do both things.
All right, Dr. Frank Cerise, the new head guy at Parkland Hospital. You just met him. Thanks for being here this morning.
Thanks for having me.